I think we'll go ahead and get started, even though it's a petite group. And just so the rest of you know, Olivia, who's on with us, is actually a vet at Desert View Animal Hospital, so she might choose to chime in here along the way. So tonight, I wanted to talk just a little bit about heartworm, but I think even before we get to that topic specifically, excuse me, one of the things I want to point out sort of as a bigger message is that if we look back, even 20 or 30 years at the incidence of certain diseases in this country, take heartworm, for example, the areas of the country that were infected, the areas, where these diseases were a concern, were fairly well contained. For example, heartworm disease was something that we would oftentimes see like in the Southeast, perhaps the Northeast. But, over the last, let's say 20-ish years, we've seen a lot of these conditions, not just heartworm, but even like tick-borne diseases, for example, migrate across the country. So the concerns that we have now, you might not have heard these concerns had you been talking to a veterinarian 20 years ago. But times have changed and the risks have changed. And certainly the fact that we get so many people in this area from other parts of the country where these diseases are a concern means that, we could be trafficking, these conditions over, from say Minnesota, New York to Arizona. And I guess in theory contributing to some of the problem. But heartworm is the thing that we want to really focus on today. And the first thing I want to point out, is that this is a disease. This is quite literally a disease that is caused by a worm. Now, there are a few things that are unique about it. And of course, this is a worm that, as the name suggests, lives in the heart when it becomes a mature adult. But unlike things like, say, Lyme disease, which a lot of people are familiar with, which is transmitted by ticks, the key thing about heartworm disease is that the mosquito is the vector. And by vector, I mean that's the insect that actually transmits the heartworms, the immature heartworms, from an infected animal to an uninfected animal. And this is typically a condition that, for the most part, affects dogs or very close relatives, like coyotes, for example. And we do occasionally see it in cats, but to be fair, since seeing it in a cat would be highly unusual and unlikely here in Arizona, we're going to sort of focus the discussion on just talking about how heartworm affects dogs. And of course, because it's transmitted by mosquitoes, and you need to have mosquitoes. And of course, the first thing, for somebody who's not familiar with the area might say is, well, you live in the desert, it's dry, you don't have mosquitoes. Well, in fact, we do. And those of you who have lived here for any length of time recognize the fact that, especially when monsoons roll around and the humidity kicks in during the summer, we get these nice warm pools of water that sit sometimes for weeks on end. These are fabulous breeding grounds for mosquitoes, not to mention the fact that one of the other things we oftentimes talk about is standing water around your own home, perhaps in potted plants or outside in the yard. Keep in mind that mosquitoes don't breed in pool water. The compounds used to chlorinate or brominate pools and spas would kill the eggs. So it really has to be sort of standing, stagnant water that's untreated, even on a street or in the storm drain, that could provide a nice breeding ground. So when the mosquitoes are active, this is when they could potentially feed on an infected animal, like a coyote, which could easily be a reservoir. We sort of, you think about the way Scottsdale is geographically located, we are located to a lot of space all around, or at least on several sides of the city. And as a consequence, you have a lot of wildlife that sort of roams freely, including coyotes, for example. And, it was often thought at times that perhaps coyotes could even be the reservoir for infections that we see in dogs. So,
your computer's talking.
I'm sorry? Oh, so when mosquitoes feed on an infected, let's say coyote, and take in a blood meal, they're going to take in these immature worms, these tiny little worms, which you can only see under a microscope. And they're going to perhaps go then feed on a dog, perhaps one of our own. And in so doing, they're going to introduce those tiny baby worms into the bloodstream of that dog. Now, one of the things that's key to understand here with respect to heartworm disease is it takes about 6 months for these little baby worms to grow into adults, which end up migrating and hopefully, from their perspective, taking up residence in the heart. And this is key because when we talk about the process of beginning the diagnosis or looking for evidence of heartworm disease, our initial screening test usually involves a test that looks specifically for evidence of adult worms. It doesn't actually look for the baby worms that might be in circulation in the body. Now, obviously, when we make a diagnosis, there's other tests that we do to confirm our suspicion. But it's an important consideration because during the 6-month period of time, you may see absolutely no evidence of anything abnormal in your pet. And of course, that means that perhaps during, late July, August, maybe even early September here in Arizona, they could get bit. And then, in fact, it might not be till, say, February, March before signs actually develop. So they have a very long sort of period of development. And so when these worms do mature, as the name suggests, they migrate and take up residence in the heart. And of course, as you can imagine, these worms in the heart will disrupt the way the heart functions, particularly the heart valves. And the heart and lungs are intimately connected, and therefore you can also see a lot of changes that are present, not just in the blood vessels, but in the lung tissue itself. And certainly when we have reason to suspect that heartworm disease may be a culprit, perhaps based on a patient's travel history, maybe just their clinical signs, and we begin this process of testing, in addition to some of the blood tests we do, we may take x-rays or radiographs to assess what's going on in the heart, or even perhaps go so far as to image the heart with something like an ultrasound or an echocardiogram. You'll find that perhaps certainly in areas where heartworm is a bit more problematic, like down in the southeast or Louisiana, oftentimes you could have worms actually get lodged in larger blood vessels in the neck because the burden of the worms is so great in these infected animals. But the process of diagnosing, and certainly the process of screening our pets here in the Valley, involves using a test, one made by a number of companies these days, that actually looks for proteins on the surface of an adult worm. Specifically a female adult worm, not the male adult worms. And when we do this test, if it comes up positive, obviously, as I was saying, there are tests that we want to do to confirm whether this is an actual fact. So, for example, we might repeat the same test twice to see if we get the same result. And then we'll oftentimes send a sample of that blood to the laboratory, verifying the test results that we obtained in the hospital, as well as looking for the immature worms that might be circulating in the blood. In fact, when we have a positive heartworm test, in fact, we can actually take a drop of blood in the hospital in real time, just a few minutes, put it on a glass slide, look under a microscope, and might very well see these tiny baby worms swimming amongst the red cells. And that certainly will confirm the diagnosis for us. Now, when you come see us, we oftentimes talk about this heartworm test, and we'll later in the session we'll talk a little bit about more what that heartworm test does for us. But we talk about the need for prevention, and of course this is sort of a constant tug of war between vets and pet owners, because sure, I understand the concerns at times. People don't want to put their pets on unnecessary medications, and maybe they just don't want to incur the expense.
It's about dogs getting heartworms.
Right. But the reality is that heartworm disease is actually quite severe.
This is a podcast they're doing.
It can be life-threatening, and at the same time, it's both expensive, and the time necessary to treat a heartworm effectively is many, many months, oftentimes approaching 6 months. So the little bit of investment up front, using a preventative, like Intercept or HeartGuard or one of its analogs, or even the injectable ProHeart, will prevent something that's far more severe down the road. And, the investment of whatever it costs to pay for the preventative over the course of a year pales in comparison to the cost of treatment. Not to mention the fact that the treatment can be painful, uncomfortable, and at times require some pretty severe restriction for your pet when it's undergoing this therapy. So I know it's a cliche to say that an ounce of prevention is worth a pound of cure here. Doesn't even go far enough to describe how important the need is to prevent. Just to be more specific, when we use these preventatives, either the monthly tablets, chews, or even the once yearly injection, at least in the case of the chews, the medication that we're administering interferes with the baby worm's ability to mature into adults. So it basically kills the baby worms. And if they never have a chance to mature into adults, there's little chance that they can go on and perpetuate the infection. And certainly these medications are designed to be administered every 30 days. If we certainly do have a pet that misses, 1 or certainly several doses, then we're oftentimes in a situation where we consider retesting these pets before we actually put them back on the preventative. But the preventatives work, and they work phenomenally well. Are they perfect? No. Certainly in areas where the heartworm burden is heavy, it is possible that some of the worms may develop resistance, and we might need to take a different approach. But this is such an easy disease to prevent, and yet one with such severe consequences that logically it almost seems silly not to take the extra step to be using the preventative on a regular basis.
Heartworms, can I say that?
Sit.
Now,
Sit.
the other thing I point out, and this is something that I think for
Good paw.
a lot of folks here in Arizona becomes even more relevant, is that during the really nice times of the year when the weather's nice, everybody's eating out at restaurants with their pets, they're at the park, they're at the dog park, they're walking.
You did it.
All of these medications really do a nice job of preventing not just heartworm disease, but in most cases they will stop your dog from picking up.
She'll do it once or maybe twice, and then she's like,
medications that excuse me, they'll do a really good job of passing on medications. Excuse me, trying to say, these medications will stop your pet from harboring and then passing on other types of intestinal or GI parasites they could give to other dogs. So it kind of does double duty for us. The other thing to keep in mind is that some of these worms, these common worms, which believe it or not, are very well adapted to living in a dog and not causing any issue, can also get into people. We don't really think about it. No, we don't really want to think about the fact that, even our very clean dog that goes to the groomer on a very regular basis does likely have some microscopic fecal matter on their body. And most of these GI parasites that I'm referencing are transmitted through what we call the fecal oral route, meaning you have to ingest a little bit of fecal material with the eggs to get the infection. So the heartworm medications that we referred to really do a lot more these days. And certainly, during, let's say, the months between October and I guess right about now, when we don't typically deal with mosquitoes, I'd say that at least in Scottsdale, we probably see more pets coming in with intestinal parasites that otherwise could be avoided. And keep in mind that when it comes to these intestinal parasites, not every dog who has them is going to show evidence. Like I said, these parasites are well adapted to host these organisms, and so stool may look perfectly normal. Also keep in mind that our wildlife, coyotes, for example, birds, rodents, things like that, are going to be more active when the temperatures are moderate. So they can also potentially carry parasites that we can help avoid if we're administering these heartworm preventatives. Now, I would say many of our clients certainly rely on a monthly heartworm preventative, but we do currently have a once yearly injection, a medication called ProHeart 12, which when administered will sort of protect your dog for a 12-month stretch. The one thing it does not do, however, is it doesn't provide that lasting protection against exposure to a variety of intestinal parasites. So if that's a concern, using one of these sort of oral agents would be a better choice, a better option. Now, just switching gears and getting back to heartworm for a moment, as I was saying, once we've established a diagnosis, the process for treating a patient who has tested positive for heartworm is long. I mean, we have a standard protocol these days, sort of developed by the American Heartworm Society. It involves use of multiple medications, some of which have to be administered in the muscle and don't feel so good when they are, which not only will help kill the baby worms in circulation and, believe it or not, attack some of the bacteria that sort of live as what we call commensal organisms with the worms. But some of the medications, the injectable ones, have to be administered to kill the adult worms. And this is where we sort of warn owners, is that once you begin this process, once you go down this road and you use drugs to kill the adult worms, when they're dead, the body has to get rid of it. And of course, the immune system is then going to go to work breaking down these worms, but oftentimes these worms break into parts so they can begin to circulate in the bloodstream. Well, as you can imagine, a piece of a worm that gets stuck someplace it doesn't belong and potentially obstructs blood flow, that's not a good thing. This is why during that period of time, it's extraordinarily important to rest your pet and make sure that they're not exercising excessively. And this is frustrating for a lot of folks, especially folks who have active dogs, because this goes on for a prolonged period of time. And so, yes, it's an inconvenience. Yes, it's a big cost. And let's be honest, any pet who has harbored a heartworm infection for any length of time does run the risk of having more permanent changes or damage to organ systems like the cardiovascular respiratory systems that we could have otherwise avoided. It seems, silly if we think about the risk versus the risk of not giving the preventative versus the reward of doing so. But the reality is it's still something we struggle with. And yet, if you look at these incidence maps, you look at the prevalence of something like heartworm disease across the nation, and you look at it over time, you'll see that the prevalence of heartworm disease, like in our area, has very steadily increased. And as a consequence, it is something that we recommend people use year-round. We don't have the climate like in North Dakota, where for a good portion of the year everything is frozen, the mosquitoes are obviously not active. Here, with a very temperate climate, it's possible that we could have mosquitoes active for longer or more parts of the year. And we need to be sure about the protection we're providing. At the same time, as I said, during the nicer months, it's perhaps arguably even more valuable as a sort of a preventative against GI parasites. Now, on the horizon, if we look forward, how are these types of preventatives evolving? Well, certainly there's a lot of products that are on the drawing board to try to take or combine the sort of protection from these types of oral medications or even a drug like ProHeart and actually merge them with the protection that's provided against things like certain tick-borne disease. And I had mentioned before that when we actually screen or perform what we call the heartworm test on an annual basis, this particular test doesn't just screen for heartworm disease. It actually looks for a number of diseases that are transmitted by ticks, perhaps the most famous one being Lyme disease. However, here in Arizona, we do have one that is endemic or unique to the Southwest that we refer to as tick fever or ehrlichiosis. And so when we do this test, we're also screening for evidence of exposure to these conditions. Now, when I say we're looking for evidence of exposure does not necessarily equal disease in the sense that you can see evidence that the patient has, that the body's immune system rather has been exposed to the bacterial infection transmitted by the tick, but they were fortunate enough to clear it and you perhaps even never knew they were sick. That said, there are potential risks down the road, even if you've seen and fought off the tick-borne disease with respect to kidney function, for example. So I point this out only because we do reference this test as a heartworm test, but it's really a screening tool. And the thing that's always surprising to a lot of folks when we talk about this is the fact that they'll often say, well, I've never seen ticks. And that may very well be true. But here in Arizona, especially let's say in the Scottsdale area, we have wild desert all around us, and we have a lot of wild animals, rodents, birds, coyotes, bobcats, things like that roaming through our yards. And ticks have this sort of unique ability to sort of lie in wait for quite some time. And of course, when a dog comes along, they can reattach. Maybe the dog is not just walking in the yard, but it's walking on a leash with the owner or it's at a park. Not to mention the fact that during the more temperate parts of the year, like in the fall, winter, and spring, you could have dozens of animals at a dog park, or perhaps dozens of animals even in a shelter, and excuse me, not a shelter, but like a daycare or a kennel. And, several ticks feeding on one dog could easily reattach and introduce something to another. So doing this heartworm test really does a variety of things for us to ensure that your pet remains not only symptom-free, but disease-free. And on the off chance they are exposed, it lets us know whose sort of kidney function we might need to evaluate down the road to ensure that they don't experience any problems or difficulties. I'll point out that just from the standpoint of prevention, there's also a topical product out there made by, I guess now Zoetis, called Revolution, for pets that may either have had or could have potentially a reaction or a reason to avoid some of the oral preventative. And Revolution can be applied topically to the skin, and then it's absorbed into the body. It's designed to be used on a monthly basis as well. And I would say that, by and large, it's not the preferred choice, and certainly it's not the latest generation preventative that exists out there. And of course, you'll find certain comparisons conducted by this company versus that company to say, well, our product provides protection that's a little bit longer than somebody else's product. But by and large, if an owner is consistent at administering the preventative roughly every 30 days, the probability of acquiring heartworm infection, if an infected mosquito were to attach to your dog, is quite low. Is it zero? No, but it's exceedingly low. Unfortunately, at least out here at present, the heartworm burden in the environment is nowhere near what it would be, say, in someplace like Louisiana or perhaps even Florida. Now, the other thing I want to point out with respect to heartworm disease is that while we certainly can treat the infestation, kill both the adult worms and what we call the microfilaria, or the small worms in circulation, whatever changes that might have occurred, say in the heart or lungs, are not things that we're likely to reverse. So this is another consideration, that without appropriate prevention, you can initiate or cause longer-term problems that would require medical management over the course of the rest of the patient's life. And so that's yet another consideration. And sort of, if you balance that with the actual cost, you come to realize it just isn't worth it. The $6, $7, $8 you might pay a month for the preventative goes a lot farther to reducing a lot of potential complications, not just when you're going through the process of treating the infestation, but also because of some of the anatomic or inflammatory changes that can occur after the fact. And believe it or not, and I think Olivia can attest to this, we see more heartworm positive dogs at times than we think we ought to. And again, obviously we see people traveling from other parts of the country that bring it with them, and even in those circumstances, we're surprised that people were not recommended to use a preventative more often. But at least as far as heartworm disease, you need to know it's here. There's no question that the value of the preventative far exceeds any risk. I mean, the medications these days have been around quite literally for decades. We know a tremendous amount about them. And even in those cases where we have certain breeds that historically have been documented to having sensitivity to one of the active ingredients called ivermectin, the actual dose of ivermectin present in tablet is far below the threshold where it's likely to cause an issue. But admittedly, we have so many other alternatives these days that if you refuse or are unwilling to use a ivermectin-based product, there's still plenty of choices that don't pose the same risk. I'll also point out that one of the newer products, again, and this is where things sort of are migrating to, called Simparica Trio, actually is an oral monthly preventative that protects you not just against the risk of heartworm, but also the risk of acquiring GI parasites, as well as providing protection against fleas and ticks, which admittedly, as I said, we do have ticks. We really don't deal with a flea problem in the way that many other folks in this country do. So, with respect to heartworm, as I was saying, it is recommended. It is something to be mindful of. And certainly the other thing I'd point out for a lot of our folks who do travel with their pets is that, if you, for whatever reason, choose not to, say, administer it on a consistent basis here, certainly if you travel to other parts of the country, it is well advised. You don't have to be in Louisiana for 6 months to potentially become exposed. You could be there for 6 days. Your pet can encounter those mosquitoes, and 6 months later, you may find out that, in fact, your pet has heartworm disease. So if traveling is your thing with your pet, it is an important consideration as well. And fortunately, the Companion Animal Parasite Council, the CAPC, I think it's capc.org, does have some really nice sort of graphical representations of where the risks for heartworm and a variety of other diseases are greatest. So if you're planning a trip with your pet, say up someplace north during the summer, you can make sure that you have the appropriate prevention on hand. Again, not just for things like heartworm disease, which is mosquito-borne, but also for a lot of tick-borne conditions, which can be a concern, certainly as well. So, with respect to heartworm, like I said, I didn't want to spend any more amount of time sort of talking about it, or necessarily even getting into all the potential physiological or anatomical aberrations that it can produce. But I did want to open it up and give you some time to ask questions, even if we sort of veer a little astray of heartworm to some of the other value and benefit of the preventatives that we use. And I'll also point out that with respect to fleas and ticks, again, it sometimes is a, for lack of a better phrase, tough sell. to owners because we don't really have an abundance of fleas. But people don't often see or appreciate the risk that ticks present. And so, but the reality is tick-borne disease is rather insidious and may not rear its head, soon after the tick bites your dog. But certainly years later it can, and tick-borne disease can be challenging to treat. Sometimes we're not even sure we're completely successful at doing it, but it also has the potential to affect a variety of body systems. And to be fair, at times it can be life-threatening if it goes untreated for any length of time. So that's another thing that should be considered and sort of brought into this lecture. Yet, and it's another reason why, on an annual basis, we do screen a stool sample to look to see if a pet is a carrier of anything that could be problematic for another dog, cat, or even a person. Nobody likes to talk about it, but yes, in fact, there are worms that people and kids sometimes get from their pets, and they can be certainly far more problematic in people than they would have ever been in a dog or perhaps a cat. So that's an important consideration as well. But that said, I wanted to see if Olivia had anything she wanted to add, and at the same time, Diane and Jeff, see if you had any questions that you wanted to sort of load out there.
Josh, you want to mention heartworm in cats?
So heartworm disease is something that does affect cats. Admittedly, it's something that, I mean, and as a general, I'd say cats are certainly a little more fastidious with respect to their grooming than dogs would be. In some parts of the country, heartworm is enough of a problem, and obviously there's a significant population of people who do have cats that dwell outdoors. And so there are heartworm preventatives for cats as well. I have to say that in my experience, I actually haven't seen a heartworm positive cat. I don't know if Olivia actually has, but certainly the concerns once the worms mature into adults, I think would reasonably be very similar to what a dog would potentially face. I don't know that I can do a very good job of commenting on the necessary treatment when a cat is found to be infected with heartworm disease. But it is a risk. I would say that, here, let's say in the Scottsdale area where, I'm based, the cats that spend a lot of time outside probably don't do real well just because of other risks found in the desert. And therefore, fewer of our clients actually have cats that sort of travel around the neighborhood. But Olivia's absolutely right. The risk of heartworm disease is real in cats, and it can be life-threatening in the same way. So, that health cliche of an ounce of prevention certainly applies to them as well. Jeff. Oh, sorry.
Yeah, does heartworm medicine, like if your dog is on, like my dog is on some antibiotics right now, does that like interfere with anything, or
really
like
very few categories
or anything like that?
No, there's really, honestly, I can't think of any class of medications that we would likely use in veterinary medicine, at least commonly, that would interfere with the co-administration of any type of heartworm preventative. So, there is a circumstance, and certainly there is a gene mutation in some breeds of dogs that has been linked with how they metabolize certain classes of drugs, and that's sort of what I was referencing before. But even in the case of HeartGuard type products that use a drug called ivermectin, the dose of ivermectin that's used is exceedingly small compared to the amount of ivermectin that would need to be introduced to actually cause a problem. But no, the short answer to your question is the adverse interactions between heartworm or medications used for the prevention of heartworm and interactions between, say, that and some other commonly used drugs, highly unlikely.
And diet either? Nothing like diet-wise?
No. The only really consideration with respect to diet is that a lot of these oral medications have flavoring agents. So perhaps beef, pork, even chicken, I'm not exactly sure. And certainly if you had a pet who had a documented food allergy, it's something you'd want to avoid so as not to trigger a reaction. But beyond that, no.
Okay. That sounds good.
Diane, was there anything that came to mind for you?
Oh, I did have one more question.
Sorry, go ahead, Jeff.
Is this something like a lifetime thing that a dog like year in and year out or monthly or?
Yeah, your dog's risk does not change with age. And so, I'm not aware of a mosquito's preference for, say, young dogs versus
Right.
old dogs. So as long as you live in an endemic area, and many parts of the country are now endemic, and would be
So
considered.
this is something that the dog would have to take
Yeah.
on what this is it like on a monthly basis or?
Yeah, the oral preventatives are usually given on a monthly basis. The injectable ProHeart 12 is given once a year. But yes, throughout the course of the pet's life, they would take it on a continuous basis to be adequately protected.
So then the once a year would be a better option then, wouldn't it? Or
It is and it isn't. I mean, certainly for those people that would forget or not be as compliant or
that's me.
consistent with the administration, it's an option. But by the same token, you also have to look at your dog's risk of exposure and lifestyle. For example, I bring my dogs to work with me. So they're around a lot of other dogs. I'll take them to dog parks. They can run around. So certainly during the nice parts of the year, I said they probably have a higher risk of getting exposed to intestinal parasites. And that's not something that the injectable will protect against in the same way. So, if your dog doesn't really socialize with a lot of other dogs, I would say the injection is fine. If you forget a lot, great. Give the ProHeart 12 injection. At least you have that protection. Treating a GI parasite is much simpler, fairly cheap and inexpensive in short term. So if you have to risk one or the other, I suppose you would risk getting the GI parasite versus heartworm.
True. Okay, I'm good.
Diane, is there anything that you wanted to bring up or ask?
The only thing I might ask is, can you hear me?
Yeah, no problem.
Okay, good. Is we can get this heartworm medicine in over in Rocky Point. Is that okay to you? I mean, is that?
This is a question it's not new. It's come up before. Honestly, I don't know. I mean, certainly there was a time, even when you went to some major online pharmacies, you would purchase medications that were sourced from other countries. That's a hard question to answer. I mean, the fact is the same quality control, the same guardrails that are in place here may not necessarily be present there. So I can't necessarily give you a good answer. Are there legitimate products you could probably buy? Yes. Are there products that are compromised that you could purchase that appear to be legitimate? I'm sure that's absolutely true. For my money, and there was a time when I can remember growing up, a lot of people went to Mexico for their medications. The drugs themselves are really fairly inexpensive. I don't know that it's necessarily worth the risk. I mean, even your mid-sized dog on a monthly basis, the cost of something like Interceptor, one of the preventatives, is like probably roughly $7 to $10 a month. It's not that significant. I don't know that that you're even going to save that much, or it's even worth taking the chance, to be perfectly honest.
Okay, thank you.
You're welcome. Do you have any other questions? Well, so if you guys don't have any questions, which is fine, this wasn't supposed to be an exhaustive lecture or topic. We'll put this up on our YouTube channel too, but thank you guys for joining us tonight, unless Olivia has anything else she wants to add.
Thank you.
Nope, you're good.
Thank you.
Thank you.
I appreciate it. Thank you.
Well, everybody have a nice night and take care.
Have a good
Take
night.
care. Bye-bye.
Thanks a lot, Josh.